registered physiotherapist. Today I'd like to talk to you about some of the things that I see typically in individuals that have issues with their kneecap or their patella. So this could be somebody who perhaps suffers from patellofemoral pain syndrome. This could be an individual who perhaps had a dislocation of the patella, perhaps somebody who has some form of bursitis around the kneecap area. So in all these cases, in a lot of cases, these individuals will present in a very similar type of fashion. So the individual, for example, who has patellofemoral pain syndrome or bursitis, or who has had a dislocation, in a lot of cases, there's very specific muscle imbalances that have created these issues. So in a lot of cases, the actual kneecap or the patella will be basically pushed laterally, so essentially on the outer portion of the kneecap. And when somebody has a dislocation, essentially what's happened is, because of these really tight structures, they're more prone to the kneecap dislocating laterally or on the outside due to a very specific quick movement along with these different muscle imbalances. So in a lot of cases with a dislocation, for example, it'll occur as a result of a plant and twist type action, or there will be a slip, or a quick sort of movement in a rotational type position. And what will happen is the kneecap will then dislocate. It will come out of this groove between the femur and the tibia and will rotate laterally. Now, in a lot of cases, what makes somebody more vulnerable to this condition, or again patellofemoral pain syndrome or some sort of bursitis, is muscle imbalances in which the person's IT band, which is essentially connective tissue that runs all the way down from the hip down to the kneecap area, attaches onto the lateral aspect of the knee. It's really, really tight. So you'll see that in a lot of cases. You'll also find that a lot of the muscles in the anterior portion of the hip, so that would be your psoas, so hip flexor, your quadricep muscle, these muscles will be working overtime in a lot of cases, and essentially will have a lot of tension, again, on the front and lateral portion of the kneecap. Now, one of the main reasons for this is an underutilization of the glute med muscle. So the buttock muscle here, as well as the glute max. So in a lot of cases, an individual might inadvertently be overusing these anterior muscles in the hip to compensate for weaknesses in the glutes, and then as a result of that, they're more prone to these type of injuries. So from an exercise perspective, it's actually quite straightforward what we want to do in terms of treatment. So number one is to actually work on stretching out these different muscles. So again, psoas muscles, quads, IT band. So lots of hip opener type of exercises, rolling the IT band, right? So that could be using a foam roller. That could be perhaps using a rolling pin. In a lot of cases, I'll have a patient roll the IT band. This could also include things like cupping, so more of a passive treatment, but what cupping is, it's a way for us to basically break up any adhesions which might be on, again, the IT band or the quadricep muscle that's limiting mobility. So that's one component of it. The other aspect too that we'll sometimes use is some form of taping to actually stabilize the kneecap and not allow it to be pulled, again, laterally. The other thing too then, from a strengthening standpoint, is actually to strengthen the glute muscle. So this could involve things like a clam exercise, in which essentially the patient lies on their side and the legs are essentially together, bent, and lifting up the top leg. So an external rotation exercise of the hip. This activates that glute med muscle that tends to be weak. Straight leg raise, again, on your side can be helpful. Working on hip hiking exercises, again, that activate that particular muscle. Balancing specific exercises can also be helpful. The reason for that is the glute med muscle is essentially responsible for keeping the pelvis parallel. So when it's weak, the pelvis will actually dip every time that we put weight, that you weight bear essentially on that weak side. And then essentially from an exercise perspective, you'd want to make it more functional, in which you teach the patient how to do exercises like lunges and squats, step ups, those type of more functional exercises, while activating the proper muscles. So in a lot of cases, these particular patients that come into the clinic with kneecap issues, they'll be underutilizing the glute muscle when they're doing these specific exercises, whether it's a squat, whether it's a lunge, using the leg press machine. So essentially trying to teach individuals, and there's various techniques to do that, to activate those proper muscles. If you have any questions or concerns for me, please feel free to leave a comment below. And as always, please check with a physiotherapist to make sure that these exercises are appropriate for you. And have a great day. Thanks again for watching. Take care.